routines unsuitable for children under the age of 10.
It is Health Diary. My name is Gladys Gashanja and we're coming to you from the premier rehab and wellness center here in Nairobi. Chiropractic is our conversation from last week. A lot of questions coming through on our social media handles. Well, we joined Dr. Hamisi Kote and his team as we walk through this practice. But before we get to it, here now is a fact of the matter. Chiropractors maintain a unique focus on spinal manipulation and treatment of surrounding structures. Spinal manipulation refers to any kind of therapeutic movement of the spine and involves the application of quick but strong pressure on a joint between two vertebrae of the spine. Chiropractors manipulate the body's alignment to relieve pain and improve function and to help the body heal itself. In addition to spinal manipulation, a chiropractor may advise you about changing your biomechanics and posture and also suggest other treatments and techniques. Now, in the last episode, Dr. Hamisi Kote and his team actually introduced us to chiropractic. And just in case you are joining us for the first time, chiropractic is a healthcare profession dedicated to the non-surgical treatment of disorders of the nervous system and or musculoskeletal system. Now, in the last episode, our patient was Abby, and she was here with a shoulder pain, and out of that, she underwent various tests. Those tests are yet to be finished, or they continue in this episode, and after that, we'll understand the kind of treatment that she will actually be administered. So at this point, let's join them even as she is handed over to another therapist. Now, Valerie, in the last episode, we did the nerves, we did the muscle, we did the body structure. At this point, what does Abby do?
So, Francisca, our sports scientist, she's going to do the movement screen test.
Yes.
Okay, so Abby will be taken through a series of exercises, but Francisca will best explain this part for you.
This is the functional movement screening stage. We need to put her on different movements. These are movements that she would use on a normal daily basis and try and look for any asymmetries or any hidden or previous injuries that could be causing the pain that she has today. And then with the results we get, we'll draft a rehab program that she'll be following for a series of weeks. And then that's what we'll use to retest again and see if there's any improvement or if there's any change.
And is this something that is done for every patient, or are we doing this for her because she has a history of a car accident?
No, this is what we do for every other patient unless the patient is in extreme pain and we don't have to put them in, movements that have to push them to too much pain. Yeah.
All right, let's get to it. And I believe just as you are, I should remove my shoes
Yeah.
and join you on the green grass.
Very good.
Okay.
And in the middle part of the mat, toes together. I'm going to ask for your arm, please. Remember, if you feel any pain during these movements, you just let me know, yeah? Okay.
So exactly what are you trying to get from this?
So usually we want to test for the range of motion for Abby's shoulders. If we don't get mobility for a specific joint, that leads to compensation. If she's not able to do a movement, she'll compensate. If you compensate, it lead to overuse, and overuse leads to injuries. Yeah?
All right.
Great. Okay, Abby, I want you to go back to stretching, and then you'll take your left up, and then the right down. So usually we'll also check for the difference. We get that the range of motion for both shoulder joints is more than perfect. It's similar. Please take your right arm, place it on the left shoulder. I want you to try and lift the elbow towards the sky. Any pain or discomfort? Where? Okay, repeat the same movement for the left side.
Essentially, if there was pain, where should she be feeling the pain with that?
Usually it will be around here, going all the way to the back, because this is the rotator cuff impingement test. So if there's any pain, we'll know that there's an impingement for that. We're going to do something called a squat. It's going to put your ankles on full range of motion, your hips, your knees on full range of motion, mobility for your back and shoulders. So many things, don't worry. Just tell me when you feel something is... I'm going to measure and tell you how far I want your feet to be out. So I need you to take your left a little bit to the side. Right? Good, so I want you to go down into the deepest squat that you can. Down. Okay. Look like you're in discomfort.
Yeah. Right here.
Okay, so Francisca, at this
Yes.
point, I noticed how she was doing the squat was not your ordinary way of doing the squats.
Yes.
Did that already tell you there was something off?
Exactly. Usually, if I've already put her in the perfect mode of doing the squat,
Yes.
but as she's doing the movement, she's already compensating because maybe her range of motion for different joints is not optimal or it's not perfect. So the body will compensate quality for quantity. She really wants to do the squat, but she'll do about anything to get down there, regardless of if the legs can let her do it. I want you to have your feet close together. Your arms are going to be placed on your thighs. I want you to slide them down and try and touch your toes. Let me see. How do you feel? That's it? Okay. Any pain anywhere? Yeah. Where? It's coming all the way from the bum.
Okay, so she clearly cannot touch her toes.
Yeah.
Indicative of what?
So tightness. Okay. Try and touch your toes again. Good. Now you see what she's doing. She's really trying to avoid the slow movement, and it's giving her pain.
Yes.
Because
So much. I feel like the whole electricity on my legs.
yeah, and you're not
Okay.
supposed to do the sudden movements. Yeah, if it gives you pain, we just stop with the movements that give you pain, and correct it. Okay, Abby. You're gonna step on the toolkit on your right leg. Okay. You're going to stand and support your leg on one leg, and then I want you to try and push as far away as you can. Any pain? Good.
Okay, so what are we testing for here?
So we are testing for her ankle mobility. So when she's on this board, she's trying to push it, the ankle joint goes into dorsiflexion movement, which is also a range of motion. If the range of motion is very limited, she will not be able to bend. Okay, and then we'll try and improve the range of motion for this.
Okay.
But if she's able to go further, we can either break down the cause to be either tightness or weakness of the ankle.
Okay.
So right now we're just gonna check on hip mobility and see if it gives you any pain on the back. Okay.
Okay.
Great. You're gonna lie here on your back. Yeah. So just gonna take this off. So Abby, what I want you to do, lift it as high as you can without bending the knee. Any strain or discomfort around this area? Okay. Put it down. Do the same on this other side. How do you feel on that side?
Yeah, there's a lot of pain.
A lot of pain?
Yeah.
Just on the knee area? It doesn't come on the hip?
Yeah.
Okay.
Not as much on the hip.
Okay. Why is one knee affecting, or rather one leg affecting the waist and the other one affecting the knee?
So this is going back, tracing back to the very first time you had any injuries. It could have been an ankle injury, a sprain. It could have been you had fallen on your back. Sometimes if the pain is originating from the lower extremity, it could affect the knee.
Okay.
But if the pain is coming from the upper back, it could affect the hip. Okay. And other times, the hip in dysfunction, or the one that is in pain, could be the one causing the upper or mid-back pain. I want you to roll over to your tummy. Try and lift your body in one rigid block. We just need to try it. And down. Any pain?
Uh-huh.
On the shoulders, yeah?
And is that the shoulder, the problem shoulder?
Yeah.
Okay.
I'm gonna do one last test. I'm gonna put this here. Yeah, put down. I want you to come right on top of this boat. One part of the body on this side and the other one on the other side. I want you to try and extend one arm out. Opposite leg out. No. Bend your elbow. Your knee to meet in the middle, then extend. Then extend. Any pain?
Yeah.
Where?
Where am I?
Around the hip. Which movement? When you're extending the leg or when you're bending it?
When I was bending it.
Okay, so what is this test for?
So hip. This is a motor control exercise. This is not a normal movement that people would do. This is where the brain needs to be active and tell, Abby, balance on one side. But if the brain is not able to communicate that easy, that means she has a motor control dysfunction. So we'll be able to try and correct that with muscle memory rehab. So we're gonna do the same movement, opposite side again.
Okay.
So you're also able to see that she's falling
Yes.
into this side. Any pain? Where? Okay.
Okay, so I have noticed she is struggling when she puts her weight on her left,
Yes.
which is something we saw also when she was doing the other movement. What does that tell us?
That just tells us that the left side of Abby is weaker than the right.
So this is a confirmation of what we saw.
Exactly.
Okay.
I didn't even see the scans.
Okay, now, so from the physical test, we move on now to the treatment. And this is where we go back to Dr. Hamisi Kote, who is the chiropractor here at Premier Rehab and Wellness Center. After the break, we find out what kind of treatment plan Abby will be put on. Stay with us.
Hii ni ya wale wanajitambua, yani wale wanajiamini. Yani someone took their sweet time and thought about us. Rembo TV, simply beautiful.
Hebu nichukulie pesa hapo nyuma.
We, kwa nini unafanyisha mtu hii kazi kama hizi? Anafaa kwa nyumbani akicheza.
Uko na kiwanja kako pahali.
Sasa hii maniki anadhani akifunga mlango ndio sasa ameniweza, si ndio?
I told you not to call me when I'm at home. Tiffany might get suspicious.
I miss you.
Okay, Mike. Just call me later.
Wacha kupiga hodi.
Wewe wacha kupiga hodi na ambiwa ni nini bana wewe?
Mami and Jerome tuko work.
Super Loaf, slices of life. Changes in programming.
God gave me the brains. He gave me like everything that I need.
Starting this Sunday, Live Clinic is now at 4 p.m.
I realized that I had a problem when I began to attempt suicide.
How was that taken?
Kutolewa mashetani.
Health Diary moves to Sunday at 6:15 p.m.
Do not accept people to call you names.
They called me specifically a beluga whale.
We discuss body image.
And the She Word moves to Sunday at 10 p.m.
To be strong. People can really be mean.
Since 1985, Nation Classic Golf Series has become the most sought-after golf series in the East African region. This year, we tee off the well-manicured courses of Eldoret and Nairobi, surpassing any other golf tournament experience in history. Join us and be part of the rich heritage of a well-structured golf series, tailored to make a positive impact as we build strong and productive partnerships. Call us now on 0719 038 251 and book your sport. Nation Classic Golf Series, the premier network in business sport.
And we are in Johannesburg, Sandton.
How cool was that bridge?
Slices of life.
This is NTV.
Naam, hujambo mtazamaji, hivi ni vipasho kwenye NTV jioni hii. Watu 6 wauawa na wengine kadhaa kujeruhiwa katika shambulio la Forole, Marsabit.
She made some noise. Police officers together with some village neighbors came to her rescue.
Afisa wa sensa vamiwa, abakwa na kuporwa alipomaliza shughuli Maseno, kaunti ya Kisumu. Hili ni kanisa la wazee ambalo halina upambe mwingi. Waumini hupewa riziki na maombi hayachukui muda mrefu. Na vita dhidi ya mihadarati vyaendelea Mombasa, huku washukiwa wengine wakinaswa leo. Na mtazamaji, ni baadhi tu ya taarifa ambazo tumekuandalia hii leo. Utajiunga nami Doreen Majala hapo baadaye tukupashe zaidi.
Breakfast is not complete without the new Minute Maid Nutri-Defense's Nectar Plus. Complete the most important meal of the day with the goodness of great-tasting juice fortified with vitamin E and zinc to complement your family's nutritional needs. Minute Maid Nutri-Defense's Nectar Plus. Breakfast complete.
Mama, how can I be a champion runner?
Well, you've got to be like a geisha bomb. Stay strong and go so far.
Strong and last long. Like geisha.
Nation FM. More music, less talk.
Nation FM.
Nation FM. More music, less talk.
I'm hungry.
Yes, with some extra fries. Delivery on the way.
So extra.
Has to be extra because extra data is always better with extra minutes. Dial *544# to subscribe and share live extra. Telkom, moving with you.
Delicious International Food and Music Festival, brought to you by Delicious East Africa and Nation Media Group. To sponsor this event, please call us today.
Thank you for staying with Health Diary. Of course, the conversation, chiropractic, and we've learned so much. But one thing that stands out is that we need to understand our bodies to understand how to heal it. And that's why Dr. Hamisi Kote, who is a chiropractor, stays with us. Now we're back to the treatment. Abby is on your table. How now do you diagnose or tell us which treatment to go with?
What we're going to do is, so we're going to check some places on the neck and the scapula, and we're going to check some place on the hip. We're going to pick the worst hip, which was this one, right? So I'll start by, I'm examining the scapula. Don't worry why I'm on the neck. Tell me, when I'm here, where do you feel it? On the hand, you feel it on the hand? Yeah. Okay. And if I do this one? Not really. Okay. Then I'm going to go here. I'm going to just do it from here. If I touch here, is it just painful or does it go anywhere?
No, it's just painful.
It's just painful. Okay, what if I go on the side here? Painful? Does it go to the hand?
Yeah.
It goes to the hand. Okay.
So, Dr. exactly what are you touching as you go along with the process?
When I come here, I'm checking for movement on the side of the scapula, which is the scapula is this board. And then when I come here, I'm checking for rotation of the scapula. When I come on the side here, I'm checking for elevation and depression of the scapula. Okay, and then I'm looking which one, when I touch, is giving her part of the pain, the sensation she's having. So we're already done here. Let me see this other side. This one has. Does it go anywhere? Where is it going? Where is it going? Is it going to the hand?
Yes.
To the hand.
Yeah.
Okay. Then we're gonna go to the hip because we found the hips to be tight. So I'm gonna touch here. Any pain? Any pain? No pain. Very sensitive. Okay. I want you to tell me, if I do this way, do you feel a sensation to the shoulder?
Yeah.
You feel a sensation to the shoulder? Okay. Okay. And then if I came here, this side. Okay, you can feel a tension also on this side. Okay, cool. I think I've picked what's treat. So in her case, what I'm finding is we're having, because remember she had an accident, and from the accident she was wearing a safety belt. So something must have really put a lot of tension on the shoulder, and that must have shifted things here, but also affected the hips, and that's why we're finding the hip movements are very limited. Okay, so I pick the shoulder blade as the painful area that we're gonna focus on, and I pick the hip to be the area that we found to be the most restricted. So we're gonna release 3 points. Point number 1, we're gonna release it. It's one like this, but on the side here. Point number 2, we're gonna release is this one. Okay. And point number 3, we're going to release is something on the front. And then we're going to test and see how she feels. There has to be, if we're right, the change should be almost immediate. So we rub back and forth. And the reason we rub back and forth is we are trying to recreate grinding. We're trying to reestablish that grinding that is missing, that is causing her the pain. Is it sending a lot of sensation to the hand?
Now, at this point, are we seeing fascia manipulation in action?
This is fascia manipulation in action. So we start with the fascia manipulation. And once we have done the fascia manipulation, we'll see if we need to do any bone correction. Yes. We take about 4 minutes for it to completely release, but sometimes the tension releases very fast. Like this is almost gone.
Somebody will be watching this and think, this is what I undergo with my masseuse. What's the difference?
Massage is general. You're massaging everything. You're doing a massage. Okay? It's not specific. Fascia manipulation is very specific.
But there are times they tell you, I feel a knot here, and they actually concentrate on that. Is that the same thing?
No. Fascia manipulation is the planes of motion. It has to be guided by the history. It has to be guided by the palpation. It has to be guided by the movement verification to be able to know exactly what is tight. Which one was sending to the foot? This one? Is that too much, or you can take? Okay. So you can see, like, now we are working on her leg, but we are reproducing the pain on the back. Down the leg, and also on the back.
When you ask how much pain the patient can take, if they can't take too much of it, how do you now moderate it?
You reduce how much pressure. For example, using the elbow, she can't handle the elbow. Maybe I can come and just work on just use your knuckle so that the patient can not be so apprehensive. We're going to do one more on the back, and then we test.
So maybe at this point we can talk about the diagnosis. For example, by just taking her history, you found there was something more complicated.
Yes.
What do you do? How do you decide it's something you can handle and it's something that you can refer?
The things that I can't handle is active infection. Okay, if somebody came here and from the history and from examination you realize they're having fever, they're having maybe their BP is everywhere, it's very high. Things that are more emergency-like, we refer out. Okay, that's number one. If somebody came here with a gushing wound or a fracture that is open and stuff, that is not my work. I send that patient out to the hospital. If somebody came here and on my examination, it directs me towards cancer, for example, then I refer that person out for further checkup. Yeah. So now we're going to do chiropractic. Okay, so we're going to manipulate here, and I'm going to manipulate here. Okay, so we start. Just need to relax and don't stress out, okay? There you go. Then you're going to lie on this side, facing me. So I go here. There you go. There you go.
Did you feel something move, Abby?
Yeah.
Wow. Okay.
Face up.
All right.
Relax. I just check. Pain or painful. Okay. So there you go. Super. Let's test now the movement again.
I am so afraid for her.
How do you feel? You must feel better.
Okay, but does it feel better, Abby?
Yeah, I feel like I can stretch more.
Okay. There's something I'm very curious about. She could not touch her toes before.
Let's try.
Can she do that
Let's try and
now?
see.
Let's see. Slowly.
Yeah.
Much better. Okay.
The other thing was raising the leg. So you can lie face up and raise your leg straight.
Oh, look at that. Yes.
It's easier. Cool. So now, after we are finished here now, it's now the exercise that we've picked is what will give her the home program.
All right.
Yes.
Now, definitely, this is not something that happens in a day. How many therapy sessions does one need?
6 visits have been the average visits that we have seen in most people.
And is there something that's taken up by insurance companies?
Yes, we are lucky that a few insurance companies local have opened more. We would say they are more opened up, and then we have about 4 international insurance that cover this.
So what would you put out there as far as embracing this practice is concerned?
Chiropractic is supposed to be a lifestyle, a way of maintaining the body to perform at optimum. Okay, when you make your body perform at optimum, you make your organs perform up to optimum, then your immunity is heightened, the chances of you getting sick become low. When you're sick, on the other hand, we still can work on you to help boost your immunity, builds that energy within your body to help the body heal itself. So what my call is to my colleagues in the medical field, medical doctors, physical therapists, nurses, whoever is seeing the patients, let's work together as a team. Because if you work together as a team, the person who benefits most is the patient. And that's why we do what we do. It's the patient, not me or someone else.
Okay.
Yeah.
All right. Thank you so much, Dr. Hamisi Kote, who is a chiropractor here at the Premier Rehab and Wellness Center. Definitely a lot of information that came out of this episode and the previous. More questions coming from you on our social media platforms, and Dr. Hamisi will be ready to actually answer some of them. them. For now, let's take time for the health tip.
You have to know which part of your shoulder muscle you are targeting. We have what we call anterior deltoid muscle here. Then you have the medial deltoid. We have posterior right behind, and then you have trapeza. So those are 4 different muscles, okay? So I'm going to start with the front, targeting the anterior muscle. There we go. Call this one shoulder raises. Front shoulder raises. Yes, slowly. Side lateral raises. 2, 3, 4, 5. Okay. Now let's go posterior. With this one, reverse shoulder raises. 5. Okay.
Definitely a very informative episode of Chiropractic. A lot of questions coming through on our social media handles. Dr. Hamisi is in a position to answer all of them. Well, it has been Health Diary. My name is Gladys Gashanjaru, coming to you from the Premier Rehab Wellness Center here in Nairobi. Until next time, see you. Thank you for joining us on Health Diary. My name is Gladys Gashanjan. Yet again, we're coming to you. I'm getting distracted. Chiropractic, and something we have learned is that there are people
wanakula
Hebu nichukulie pesa hapo nyuma.
Acha udhuda. We, kwa nini unafanyisha mtu hii kazi kama hizi? Anafaa kwa nyumbani akicheza.
Uko na kiwanja kako pahali.
Sasa hii maniki anadhani akifunga mlango ni sasa ameniweza.